Are you vaccinated?
Yes, I am.
No, I'm not. Yes.
Not completely.
Not taking those jabs.
What's going on, family? We're out here at the beautiful Lake Montebello Farmers Market in downtown Baltimore at the world-famous Lexington Market.
Baltimore Inner Harbor, man. We're having COVID conversations, and I'm the man on the street. Wanted to ask you, are you vaccinated?
I only got it because I feel like society forced us to do it.
Okay.
And this is for my mother's safety.
I seen the people that didn't vaccinate it, they was catching it more than people that was, you know what I mean?
That's right.
I mean, you know, when you go to the store and buy cough medicine, you don't know what's in it.
I can never find a good time to get vaccinated. I have a really busy schedule, like going to college and all.
I'm not the kind of guy who leaves the house often. I got a strong enough immune system. I figured I could handle it.
We're not gonna know the side effects of the vaccination 10 to 20 years down the line.
You know what? Speaking of side effects of the vaccination, I done heard some crazy stuff about the vaccination.
The inflamed hearts, I believe. is that myocarditis or some shit like that?
And like you couldn't get pregnant, won't fertilize you.
So based on all the facts that I have seen so far, I haven't seen any proof. Find me the solution, the cure, not this freaking cocktail of vaccine.
I mean, like when it first came out, it was like, the way I perceived it, it was like it came out and it was just like, here, everybody here, we're gonna test it out on y'all. Instead of, here goes some facts behind it. It wasn't enough like proven facts and test runs, in my opinion.
Okay. I was just asking because I know it has been some, but some people saying there should be more. So I'm just listening. Man.
Alex, let me tell you something. COVID, coronavirus, has been around for a long time. I know, surprise, surprise. But the common cold is caused by coronavirus. If you've ever heard about the SARS coronavirus outbreak, that happened back in like 2002. There were minds, brilliant minds across the world that were working to make a vaccine that would protect us from something so devastating as a mutation that we couldn't fight. That is what happened in this global pandemic. There became a new strain of coronavirus that we've never seen before, and governments just poured out money so that they could be able to pay the folks that were working night and day to create a vaccine to protect us. And so that's what we saw. It's not a rush. Thought was put into these vaccines. They're safe for you to use, and they're gonna protect you and your families and your loved ones. All right, I'm gonna let you chill right now.
Even if it's not 100% efficacy, I think it's still worth getting the vaccine.
Corona is here to stay. It's not going anywhere. You never know if it's gonna get as bad or worse than it was before.
The more information that's coming out, I'm feeling a lot more comfortable with it. So in the near future, probably by the end of this year, if everything goes right, I'll definitely get them back.
All right, we're gonna make that a family thing, man. My man Kevin and his kids need vaccinations, you know what I mean? Appreciate you, Chan.
No problem, family.
We just got a couple really important questions. The first one is, do you believe that ginger ale cures COVID?
Nah.
Ginger root proven to be healthy. Ginger ale goes good with whiskey. You know what I mean?
I don't think so.
Never was a fan either.
Wow.
Now, understand that people of color, we have an immune system, opposed to the Europeans. They have one, but it don't work. They don't have enough melanin and all this stuff in them, right?
They don't got what?
Enough melanin and stuff to switch to turn on like immune system.
Work out, and also I don't want nothing inside my body that's gonna stay inside my body.
I'm a little worried about putting something in my, veins.
I'd rather take care of my body first before somebody telling me what I should do.
I can't tell you what to do, but I can tell you to be healthy. You go outside, get some vitamin D, run some laps, do some push-ups, do some pull-ups, meditate.
Raw vegan diet. How to raise our immune system. 5 vegetables, 5 fruits a day, drink plenty of water, get away from the dairy.
I haven't had a cold in over 5 years.
Maybe natural immunity has built up more down there. Maybe they reached a plateau.
I did come down with COVID, did my whole holistic regimen.
I was hit harder than my entire family, despite having the healthiest practices out of my entire family.
I'm 50 years old. I ain't worried about 50.
Yeah.
Okay, while eating healthy and staying active does help prevent pre-existing conditions that make COVID-19 dangerous, this pandemic does not discriminate. We have seen its impact on all ages. Health doesn't look the same for everybody. And even if you may not have a severe reaction to getting infected by the coronavirus, that doesn't mean that your partner, your family, or your neighbor will have the same. situation. Nothing strange is going into your body in terms of the vaccine, okay? We are just learning the most recent cheat codes to give your body the best fighting chance against COVID. Again, the point of the vaccine is to reduce hospitalization and decrease chances of death from severe illness. It doesn't prevent COVID. It's not 100% cure. So let's keep going to the gym, okay? And pump our immune muscles with our regular COVID vaccines and boosters. Keep on pumping that iron, boo.
I work out, I eat right, I'm healthy, but I do also understand, the responsibility of keeping other people safe.
Sleep more, drink water, exercise, and live a low-stress life and find some spirituality, a higher power.
What was the first one? The one that they only needed one shot?
So it's 3. You got the Johnson & Johnson, Pfizer, the Moderna.
Yeah, I got Pfizer.
Okay.
Moderna. P-Pfizer.
You actually got Pfizer, but my sister earlier told me we gotta call it P-Pfizer. What vaccination did you get, Jeffrey?
I got the COVID thing?
Yeah, I'm saying which one?
The first and the second one. We got the first one. Then we had us to come back in 2 weeks for the second. Got the second.
When they first said something about it, I got all of them.
That's right. That's good.
I got my cards. You want to see my cards?
Next time.
Okay.
You are vaccinated, right? I see you're with someone. Is the person that you're with vaccinated? Or we don't talk about other people's vaccination status?
No, we ain't gonna do that.
So y'all friends and family members that's not vaccinated can't come and see y'all?
Well, they can come, they just gotta stay masked up.
And then govern yourself.
All right, so let me
watch the people you're with, wash your hands, don't eat at every place in town, don't be everywhere with everybody.
Okay, we got Pfizer. And so what caused us to get Pfizer over like the other ones?
Well, to be honestly speaking, at that particular point, it was like the first one, you know,
that was made
legit
available.
and the first one available.
In the beginning, there was just too much mixed information.
I understand.
At the beginning, there was so much, and I didn't feel comfortable. I wanted to kind of let, the people who were creating the vaccines kind of get their kicks and things out.
All right, let's be real here. There is no way the vaccine can help 100% protect you from being infected. Like several other viruses like the flu and the common cold, finding a cure-all is difficult because the virus is constantly mutating. That being said, having the antibodies from a vaccine can prevent you from having severe illness. That is the point. The CDC reported that more than 164 million people have already been fully vaccinated. That's over 50% of us. And yet, 97% of the folks that are being hospitalized from COVID-19 are unvaccinated. Just do the math. You don't want to get stuck with that fat hospital bill. The main thing that you need to know is that the vaccine is supposed to, 1, decrease the ability for you to spread and infect others. But more importantly, it's supposed to decrease the chances of you getting severe illness, being hospitalized, and dying from the disease.
I would say if you're not vaccinated, just do it. Just do it. It's a simple shot.
If you don't get it, it's on you. It ain't everything that happened to you after that. Yeah. But if I say you get vaccinated if you got kids or you got loved ones that you're trying to be here for, then it's best that you get vaccinated.
I simply don't trust in the government when it comes to medical.
Everybody think it's a conspiracy behind every little thing,
I understand. Listen, trust me, I understand for real. And so, where did that distrust come from,
Honestly, from growing up.
Experiment that happened decades ago with syphilis and black men, people saying that they were trying to inject us with COVID.
For some reason, some people wanted to bring up the excuse of the Tuskegee experiment, which doesn't really make sense to me because that whole experiment was about not giving those people the medicine for what they needed.
For me, seeing people that were in my profession and also higher up, like physicians, medical directors, going ahead and taking the vaccine kind of let me know, okay, they're probably not experimenting on us.
Black and brown people systematically have been oppressed through medicine.
As well as the contributions that we have made. And it's the contribution part that the majority of black people do not know. The woman who led the team to develop the Moderna vaccine.
What was she?
A black woman.
And where was she from?
UMBC.
Yes, she
went
did.
to UMBC.
Yes, she did. Historically, right? I don't know anything from the government that's been given for free, that's been good. People who run the American government are descendants of other people who have been involved in running the American government and other systems of power. Medically, we're supposed to trust the information that they're disseminating. I don't think so. These are the same people. They come from the same club.
We have the right and the reasons to have hesitation and to have distrust as far as the medical system in this country goes. We know about the history of the Tuskegee experiment, about Guatemala, about the sterilization of Black and Indigenous women. And we even know now about the maternal mortality crisis that our Black mothers are facing in this country. We know that racism is a public health issue, and that structural racism is currently prohibiting so many folks that look like us from receiving the health care that they deserve. But there's hope. We had Dr. Kizzmekia Corbett, who worked night and day on this vaccine. The vaccine wouldn't be where it was without her contributions. We have more and more doctors that look like you, who are working to educate you so that you can make the best decisions for you and your family. We are able to see the impact that COVID-19 has had on folks that look like us. We have not had the same access to vaccines, and so it is so important that you get the information that you need to be able to make the best decision for your family, and I hope you get that here.
What you believe?
You should get vaccinated. Not only helping you, but it's like you helping others. Like not helping, but you know,
protecting.
Yeah, exactly. Yeah, exactly.